Have you ever experienced difficulty swallowing with things getting caught up in that esophagus? You may think this is a minor issue, but in today's video, I'm going to explain the long-term consequences from this. I'll give you an example of a patient of mine that had this issue. And at the very end of the video, I'll give you my tip on what I recommend to get this taken care of. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic. Come see us up at Gastro for all your GI needs. So we have a 35-year-old man coming in to see me in the office for difficulty swallowing. He has noticed for the past couple years, things get caught up in his esophagus. Initially it was just bread, but now it's progressed to the point where even when he has meats, for example steak, it gets lodged in his esophagus. In fact, there's even one point in time where he got stuck in which he had to go to the emergency room. Luckily, he was able to vomit and that piece of steak came up, but because of these concerning symptoms, he came to see me to find out exactly what is going on. Now, his past medical history also included asthma, he had some seasonal allergies, he also had the occasional acid reflux. He currently was not taking any medications, and he had no other prior surgeries as well. On physical exam, he had some mild pain in the epigastric area, right above his sternum. A little bit of pain in that area, but otherwise the rest of the exam was normal. So when I saw this patient, there were a couple of things that came into mind in terms of what's going on. We have what's called a differential, which is a thought process for some of the conditions that may be causing this issue. Now, one of them is the most common condition for dysphagia, which is a stricture in that esophagus. Now, a stricture is literally a narrowing in that esophagus, and that can cause symptoms of dysphagia or difficulty swallowing, which is what this patient has. Dysphagia means difficulty swallowing, meaning things are getting caught up as it's going down. Now, the way we describe dysphagia is that there's two main types. There's oropharyngeal dysphagia. The next is esophageal dysphagia. Now, for oropharyngeal dysphagia, the issue is the problem with the initiation of the swallow. So as you try to swallow, food actually goes down the wrong pipe. It actually goes down to your trachea. So these patients commonly complain of choking whenever they swallow, gagging when they swallow, coughing when they swallow. It is a problem with the bolus transfer of food from the mouth into the esophagus. The most common reason for this is some sort of neurological problems, whether it's Alzheimer's, stroke, dementia. It's the problem with the brainstem or the brain in terms of making sure you have the correct movements to move things from the mouth into the food pipe. And instead it goes into the trachea, causing these symptoms to occur. Now, these are very specific symptoms. You have coughing whenever you initiate the swallowing. You have choking whenever you initiate the swallowing. You have just gagging whenever you initiate the swallowing. And in the right history, in the right patient, typically elderly, dementia, stroke, or Alzheimer's, this is kind of the route you want to go down. Now, obviously in our current case, this is a 35-year-old man. He doesn't have these other medical problems. Now, if you're worried about what's called oropharyngeal dysphagia, what do? What you certainly want to do is called a modified barium swallow with speech pathology. And in this test, they actually see what is going on when you swallow some barium to look at the mechanism of the swallowing to see if that may be impaired or not. Now, going to esophageal dysphagia, you have two main types in there. You have trouble with solids that progresses to liquids, or you have trouble with liquids and solids at the same time. So when you have solids progressing to liquids, that is a mechanical problem. And that is where a stricture normally plays a role. So a stricture, once again, is a narrowing that esophagus. The most common reason for a stricture is acid reflux. So you can have a stricture even if you don't have typical acid reflux symptoms. You actually may have what's called silent reflux. It's actually a very common condition. A lot of patients have it. They don't even realize that they have it. You have acid going up into the esophagus, causing narrowing and stricturing to occur. And over time, it becomes so narrowed that things get caught up in that esophagus and does not want to pass through. Now, another reason for dysphagia is a condition called eosinophilic esophagitis, or EOE. Common condition that we see in the younger individuals, typically in their younger age, but we're seeing it more and more in adults. And you have typically a trilogy of other symptoms. You have difficulty swallowing, or dysphagia. They also have a history of asthma and atopy. That triad of patients typically is a patient which has EOE. Now, this is most commonly seen in young Caucasian men. Now, this individual who I'm describing absolutely could fit the stereotype of EOE. And the way we diagnose it is that we actually take a look with an upper scope, take some biopsies, look at it under the samples, and see if we have a lot of what are called eosinophils in that sample. Eosinophils are allergic cells that can predominate inside the whole body and then cause scarring and narrowing to occur in that esophagus. Now, if you have EOE, a couple ways we can treat this. We can give you an acid reducing medication. Surprisingly, acid reducers have been shown to have an anti-allergic effect, so you actually decrease the allergies in your esophagus to actually decrease the risk of you having this. Sometimes we can also go in there and get some steroids or even eliminate certain foods to minimize your symptoms of EOE. Now, another condition that can cause this is a condition called Acalasia. What this is the inability for your lower esophageal sphincter to relax. So normally at rest, as you're sitting here chilling out watching the video, your lower esophageal sphincter is contracted. It is tight. And this prevents acid from going up into the esophagus all the time. Whenever you swallow, you breathe in air, or you eat some food, as that food bolus goes down the esophagus and it hits the lower esophageal sphincter, it will relax and cause food to go into the stomach from the esophagus. For individuals who have achalasia, there are two problems going on. One is that they don't have any peristalsis. It's like a lead pipe. Nothing will propagate through. But not only that, you have the inability to relax that sphincter, meaning it's chronically tight. It is always tight. Nothing's going to open up. And these patients have difficulty swallowing. Now, sometimes we can see remnants of this when we do an upper scope. Now, in most cases, the way we diagnose this is with what's called a manometry. This is a probe in which we actually check the pressures of the esophagus to see, number one, do you have contraction or peristalsis? And number two, does the lower esophageal sphincter relax? If you have this, we have different mechanisms to treat this. So with all this differential going on, what is the next step? For anyone who has dysphagia, we recommend doing what's called an upper endoscopy or an EGD to see exactly what is going on. That gives me visualization of how your esophagus is. I can see narrowings. I can see strictures. I can see inflammation. I can see ideas of achalasia to give us a picture of what's going on. And while I'm down there, I can maybe stretch out the esophagus, get that fixed, and get that resolved. So after talking to this patient, we decided, all right, we'll take a look with an upper scope. We'll see what's going on. I'll see if I can fix the issue and hopefully get things taken care of for him. So we did the upper scope, and we actually found something I was not expecting. We didn't see a stricture. We didn't see EOE. We didn't see achalasia. We saw cancer. Yes, esophageal cancer. So esophageal cancer also is in the differential for difficulty swallowing. This guy had a rip-roaring cancer in the esophagus, and that cancer came from a condition called Barrett's esophagus, which is a precancerous lesion in the esophagus. And the biggest risk factor for that is chronic acid reflux. So unfortunately, this individual got diagnosed with stage 4 esophageal cancer, and he's currently battling these symptoms. So obviously, I don't expect to see esophageal cancer in somebody less than the age of 50 years old. This is typically an old person's disease. Now, the biggest risk factor for esophageal cancer is chronic acid reflux. Now, this is not reflux that's always there. And that's the scary thing. It's reflux that typically comes and goes off and on, but has been there for quite some time. When you have chronic acid reflux, even intermittently, that acid that goes up into the esophagus changes the mucosa of that esophagus to make it switch from normal cells to abnormal cells. Your esophagus hates acid. And whenever it gets attacked by acid, it wants to do what it can to protect it. And it starts changing these cells to give it a protective layer. But the problem is that these cells don't stop. They keep on changing, then become malignant, and eventually it will progress into cancer. And do you know what the most common symptom is of esophageal cancer? It's trouble swallowing, dysphagia. And so even though this individual was young, had really no other risk factors, he actually ended up having a cancer in his esophagus that was causing his symptoms. So what do you need to know? Well, number one, trouble swallowing is never normal. Let me repeat this one more time. Trouble swallowing is never normal. If you're having any issues with things going down, you're having to hit yourself, you're having to find out you're not eating as much, food is getting caught up, water is getting caught up, do not ignore these symptoms, because by the time you're having these issues, there's something going on. It's not normal for things to get stuck. It's not normal to have trouble swallowing. It is not normal for it to take its time going down. If you're having these issues, come see me. We can do what's called an upper endoscopy. You receive the whole time. I can assess what's going on and hopefully get things taken care of you. It is uncommon for me to find esophageal cancer in somebody less than 50 years old. However, I've had cases recently in which we've seen this, and so if you're having these issues, don't become a statistic. Come see us where we can find out exactly what's going on and hopefully get things taken care of for you. Alright guys, thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel and newsletter where you can get great tips and tricks like you're learning in today's video. Thank you for watching. Don't forget, let's talk about poop. Thanks everyone.